Hey, y'all.
What up, y'all? And welcome to the Birth Squad podcast. If you've been riding with the squad,
hey, fam.
And if you're new,
welcome to the squad.
We're your hosts, Dr. Ijama Kwandu and Dr. Kamisha Thomas, two licensed obstetricians and gynecologists, as well as best friends.
We use real stories to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope you love learning about our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. Please consult your healthcare provider for your specific care.
So to learn more about us and for more information, please visit our Instagram at The Birth Squad and our Twitter at _The Birth Squad.
Please keep in mind that the following episode may cover topics that could be triggering to some individuals. Listener discretion is advised. Meet Sasha. She's the next badass birth warrior who will share her story to help the squad navigate through the complex and inspiring journey of pregnancy, labor, birth, and motherhood.
In this episode, we're talking about a potentially life-threatening pregnancy complication, pre-eclampsia. During the interview, you may notice some medical terms or jargon, but don't worry, we got you. We have included definitions and explanations in the episode description. So please listen up and enjoy her story. Hello, welcome back to the Birth Squad. I'm so excited this week because we have the privilege of interviewing my best friend from first grade, Sasha. Hey, Sashi.
Hey, how's it going?
Good. Thank you for joining the Birth Squad today.
Thank you for having me.
Yes. So we're going to get right into it. Do you mind telling us about yourself, your age, and kind of your family dynamics?
Yeah, so I am 35, turning 36 in a few months. I am married, been married for 3 years, and I currently have a 15-month-old son.
So what called you to pregnancy? What was kind of your path to motherhood?
I can definitely say I never had an innate desire to be a mom. When my husband and I were like dating and when we got engaged, he used to even say like, I never hear you talk about, children or having children in the future. I just want to make sure that that's part of the plan because I really want children. And I said, okay, well, if we actually get married, I'll make sure to give you, at least one. So it was definitely never an innate desire, but I did always want a family. Parents are divorced. They were divorced when I was 3 years old. So I always did have a desire to have, mom and dad in the home, and having children, but the whole like natural desire to have a kid, I never really had that. So we got married middle of 2019, COVID hit beginning of 2020. I had the IUD for a couple of years at that point, got rid of it. And so I had like a 2-month window. And so I basically was like, hey, I'm ovulating this month. I feel like we should just try one time and see what happens. And then, got pregnant right after that. So moral of the story, once you stop birth control, you are immediately no longer protected from not getting pregnant. There is no such thing as downtime. So it just kind of happened.
So Sasha brings up an important discussion right from the beginning. Not everyone feels the desire to have kids. In fact, a lot of people may not even enjoy pregnancy. And we're here to say that is okay.
In fact, that's normal. Everyone's path to pregnancy and parenthood is unique. We and your squad are here to support you through it.
So tell us about your feelings during pregnancy.
My feelings were not happy. The nausea hit in like week 7 or 8, and it stopped the day I gave birth. And I think what made it so bad and so annoying was that every time I saw the doctor, it'll resolve in week 10, it'll resolve in week 11, it'll resolve in week 15, it'll resolve in week 16, it'll resolve in week 20. And so I think that I had an expectation that one day I would wake up and it would go away. And for me, I had it 24 hours a day. So it was like a trade-off. If I would drink water, then I couldn't eat for the rest of the day. If I would eat, then I couldn't drink water. So I was always battling being nauseous or being dehydrated. I was on prescription medication the entire time as well, which made me really, really drowsy. So drowsy, dehydrated, nauseous 24 hours a day. Even in my third trimester, I was losing weight because I was not eating. So it was a lot of stress. So that was a pretty miserable experience all around.
Now, what Sasha experienced is called hyperemesis gravidarum, or hyperemesis. This is a rare subset of nausea and vomiting in pregnancy.
Nausea and vomiting in pregnancy is a common symptom that starts around 6 to 8 weeks. Ironically, the symptoms are triggered by hunger. We treat it using 4 different approaches. Number 1, behavioral modification, which includes avoiding triggers like foods or smells, eating small, frequent meals, and eating bland food. Number 2, over-the-counter remedies like ginger tea and candies, or carbonated or cold drinks. Number 3, over-the-counter medications such as vitamin B6 and a type of antihistamine like Benadryl called Doxylamine, which is also known as Unisom. Often when you are nauseous, your mouth will water. So this medication aims to dry out your mouth or your mucous membranes to help break the nausea vomiting cycle. And last, number 4, prescription medications like Reglan or Zofran to actually stop the vomiting.
Also, a bonus birth squad tip. It's important to note that actually taking a prenatal vitamin that has folic acid in it before you actually conceive can decrease the incidence of nausea and vomiting in the first trimester of pregnancy. But in Sasha's case, her symptoms were super severe. Now, one thing everyone should understand is that morning sickness does not always occur in the morning. And unfortunately, it is not promised to end by the second trimester. We don't really always know who's going to develop mild or severe symptoms.
Usually, I refer to the trimesters as dreary, cheery, and weary, meaning that during the first trimester, you feel terrible, while in the second trimester, your symptoms have mostly resolved and you feel great. But by the third trimester, you're starting to experience fatigue and discomfort as you end your pregnancy. But it sounds like it was dreary the entire time for Sasha. So, what is hyperemesis and how often does it occur?
Well, it's severe nausea and vomiting in pregnancy that causes weight loss and electrolyte abnormalities in some cases as well. It occurs in less than 3% of all pregnancies.
How do you treat hyperemesis?
Like Sasha mentioned, we put you on around-the-clock scheduled medications. These are the things that Kamisha mentioned earlier. And in some cases, you may require hospitalization or IV hydration or regular infusions as an outpatient. Now we're going to get back to Sasha's story to hear more about her experience. But please be advised that this could be triggering for those who have struggled with mental health issues. So how would you say your mental well-being was? I know that just sounds so traumatic that you basically were sick every single day.
Definitely very, very depressed. I have to say that like my partner was the perfect partner at the time because he was just, I wouldn't shower for like 5 days. He didn't care. I would be in bed the whole time. He would walk in, the room smells a little funky, but he didn't care. He'd walk in, give you food. So he was very supportive in that sense, but like my mental health was down the drain. Definitely didn't want to do it anymore. Definitely was like, why did I get myself into this? And I think what made it worse was that I had an expectation for the first 5 months that it would eventually go away. But because now we're like in week 24, still nauseous, and then I realized I'm going to be one of the few that's going to be nauseous the entire time. Definitely many evenings. Sometimes my husband would work overnight at the hospital. So there'd be many evenings where I'm alone, I'm up at 1 o'clock in the morning trying to text him. I did call the suicide hotline twice just because I was losing my mind. Days where I wouldn't brush my teeth, just miserable, wouldn't wash my hair for weeks. Now I can talk about it, but back then it was just darkness.
Yeah, so it sounds like you really were struggling.
Very much.
And it sounds like there was, probably some component of depression during the pregnancy. You mentioned calling the suicide hotline.
So I just wanted to talk to somebody, like, live text, live, free chat, something. I did go on like forums online, I did like talk to my mom, and she wanted me, I was living in New York and she was in California. She kept saying like, just come home. But I just felt like I didn't want her to see me this way. And that I felt like my husband, who was, a current medical professional in the hospital every day, was like used to seeing patients and was like ready for this. And I felt like he was able to kind of shut off certain parts of our relationship and turn on other parts, like the care. And so I just didn't want, one, I felt like I would be kind of embarrassed in front of my mom. And I just didn't know she was ready for like the around the clock, I'm sad, I'm miserable, I hate this kind of thing. I just didn't want to put her through that. I talked to my best friend, you, Dr. Okwandu. But that's pretty much it in terms of resources.
Thank you for sharing that, because I know that's like a really tough experience that you went through, and obviously a lot of trauma associated with it.
Mm-hmm.
Wow. I want to take a moment to acknowledge and appreciate how vulnerable and honest Sasha is being. Depression in and outside of pregnancy is a real and serious issue that many face.
Like Sasha, we encourage you to reach out for help. Whether it is that you lean on your squad, or you talk to your healthcare provider or your mental health provider, or even start taking a medication. We also want you to know that taking antidepressants in pregnancy is safe. Many women may have concerns that they want to completely avoid medications in pregnancy. But I want you to know the most important thing to remember is that taking care of you takes care of the baby. So prioritizing your health, your mental health, and your whole being will make you a better parent. So do what's best for you.
And we just want you all to know that you are not alone. We'll be diving into depression, anxiety, and other mental health challenges in pregnancy in a future episode, so stay tuned. Now let's dive back into Sasha's birth story. Be advised, this could be triggering for those who have experienced labor and birth. We recognize and understand the significance of birth trauma.
So now we're going to move towards your birth experience. So you went the full, probably 39,
yeah, I
40
think 39 and a half weeks
of misery, basically. Your body changing and kind of, turning against you in some ways. And now it's time to deliver babies. So kind of tell us what happened leading into that moment.
Started labor Wednesday morning, was at home for like 24 hours. And man, I feel like my pain tolerance is pretty high, but I had what I like to call lower back contractions. And so when people ask me what it felt like someone took two knives, dipped it in hot lava, like from a volcano, and stabbed me in my lower back and was twisting the knives like, That's what it felt like. So I waited until it got to about that point, and then we went to the hospital. This would have been Friday morning at maybe like 4 a.m., something like that. But I arrived there Friday morning and I was in triage. And they brought me up to labor and delivery. I know that the most I dilated was maybe 5 centimeters. That was the most, but to even get to that, they did do the balloon situation. So I had a catheter as well. So I did get the epidural. That was a pretty bad experience. They had a CRNA in training do the epidural. And so it was her, and then an actual CRNA was sitting next to her, coaching her. And then the anesthesiologist was standing a couple of feet away. So it was 3 of them behind me, but I could hear the CRNA coaching the CRNA in training. So that was like, I could hear him say, oh, pull it out an inch. Okay, a little bit more to the right. Tap, tap, tap. So that was like because I don't know what's happening behind me, right? And they didn't warn me that below my waist would go numb and I wouldn't be able to feel anything. So when everything starts going numb and I can't move my toe and my lower half of my body's feeling very, very heavy, I'm like freaking out because they didn't warn me about that.
Now, hold on. This is important and something that has led to a lot of trauma for many birth warriors.
What she is describing is a lack of transparency and lack of communication. Miscommunication is actually cited as the most common reason for medical errors and dissatisfaction with health experiences. This is an opportunity for growth and true informed consent is important. So, what does informed consent look like?
Well, in Sasha's case, it would be letting her know that a licensed nurse in anesthesiology is going to be doing her epidural. And also that letting her know that the person in training would be with her. Or asking her, is it okay that a nurse in training be part of her care?
It would also be letting her know what type of pain relief she could expect from an epidural, which includes numbness from her abdomen to her toes.
We want you all to advocate for yourself. If something makes you feel uncomfortable or you don't understand it, ask questions. And if you don't feel comfortable asking, then let your squad know so that they can help you. Because we understand that advocating for yourself can be really hard, especially in this vulnerable time. That's why your squad is there. Now let's hear the rest of Sasha's experience.
But yeah, so the most I ever dilated was 5 centimeters. So at this point, it's like 4 p.m. or something like that on Friday. So we just opt to do a C-section. And my temperature was getting a little, not high, but I think I got to like 100 or so. So, and then the C-section experience, that was also traumatic. I feel like it's all traumatic. So the C-section part is okay in terms of like getting the baby out. I remember them showing us little Matisse, but I will say that the numbing process, there was something going on where numb from the waist down. During the process, something happened where I started to feel the numbness creep up into my chest area. And so it felt like I was drowning. CRNA was next to me, and I remember tugging on his shirt and saying that I feel like I'm drowning. I feel like my chest is getting very, very heavy. And I remember looking at my husband like I'm feeling like I'm being buried alive is kind of how the feeling was, because it keeps creeping up, creeping up. So now like it's in my neck area, my chest area, like in my shoulders. And so I'm feeling like I can't breathe. And I remember him saying something like she's foaming at the mouth. And I remember looking at my husband, and in my mind, I was like saying my goodbyes in that moment because I'm feeling like I'm about to die because I can't breathe. And then it kind of goes black for a moment. But I do remember it getting fuzzy. I do remember things going black and then waking up in the recovery room.
So it sounds like it was obviously, again, another traumatic experience, lots of events that were unexpected and challenging.
Yes, for
but
sure.
tell us a little bit about, seeing Matisse for the first time.
Oh, seeing him was very like, so I remember seeing him and I was just kind of like, okay, he's good. Like mentally, it was like checkbox. All right, we'll do our skin to skin a little bit later. I just got to get through this because I had been in labor at that point for like 48 hours. Did the Pitocin for like 12 hours. Did the balloon. Did the epidural at that point. Now we're in surgery. So I just remember seeing him. I don't remember feeling joy. I don't remember feeling like, oh my gosh, this miracle. I think I was just, by the time I got to delivery, I had nothing left. So I just remember when I saw him, it was just like, okay, he's good. Check box. I just got to get through this part right now. And then and then we'll have our one-on-one time. Yeah.
Yeah. Thank you for keeping it 100. I mean, it's how you felt. And I'm sure it's a lot. A lot of women feel that way too, especially given everything you were going through. Okay, so now we're going to get into the postpartum phase, right?
Mm-hmm.
You're my bestie, so I obviously know what happened. You got preeclampsia, right?
Yes.
So what were the symptoms of the preeclampsia?
So during pregnancy, I always had a low, or my blood pressure was always like medium low. And then towards like second, third trimester, sometimes it would go up to like 132. So I do remember during pregnancy, I did take my blood pressure sometimes like every day just to check it. But it never went up. I think the 140 is where I was supposed to monitor. Like if it goes above 140, then, say something just in case I may be a candidate for that. But it never went above 140. So we didn't really talk about it anymore. And then in terms of the symptoms that would be associated with preeclampsia, I never really discussed that with my OB. It was more so just monitor your blood pressure. As long as it stays under 140, there wasn't really much more to talk about. So now we're in postpartum and I have a really, really bad headache. So I'm laying down flat. I couldn't even sit up. I would just get this crazy, crazy, crazy headache. couldn't go to the bathroom, like none of that. So after this really, really bad headache, I did a consultation with a neurologist. They put me on 2 liters of fluid to see what was going on, what's going on with this terrible headache. Met with the CRNA team, the anesthesiologist. Maybe we can do a blood patch for you. I had a CAT scan as well. So all this was happening within like the first 24 hours of postpartum to figure out why I had this terrible headache. So 2 things happened. I decided to do the blood patch, and and just like for the moms out there, while I'm doing all of these things, I'm also going to the NICU, learning to breastfeed, meeting with a lactation consultant, trying to squeeze a drip of milk out of my nipple, trying to figure out what's wrong with my nipples and massaging them. I'm using a pump as well. I can't sit up because I have a terrible headache. So the baby comes and he's like, lying next to me on this tiny hospital bed, trying to turn to the side, but I just had a C-section, so it's hard to turn to the right or the left. So like, I'm just like, it's like an out of body experience. And I know at some point I'll go home and like wake up from, I don't want to say nightmare, but it's just like, I'm not really present. I'm just going through the motions. So I do opt to do the blood patch. So fast forward to the blood patch. It's very similar. They take the blood from the back of my right hand. And I guess it's similar to an epidural. They're inserting it in my lower back again. So that whole process. So with the blood patch, they said that I had to lay on my back flat for at least 2 hours. So I get the blood patch laying on my back. And then, of course, within 10 minutes, I have to go pee. I start to get a little bit of a headache. I feel it coming more. And then my blood pressure starts going up. And so I'm hooked up to the machine, but I remember seeing like 135, 140, 145, 146, 147. And it got to some level where it started to beep nonstop. I think that was 150. And then when the machine starts beeping nonstop back to back is when I start, and I just start yelling blood pressure, blood pressure, blood pressure. And I remember like 5 people swarming around me. The last I remember seeing on the machine was like 171, but then my vision started to get blurry, and I felt like I felt a lot of pressure on my heart, like I couldn't, and on my chest, like I couldn't breathe, like I couldn't, my chest cavity would not expand, and my vision was going blurry until it was like completely black, but I knew my eyes were open. Like I said, I remember seeing 171 on the machine, and my husband did come in. I remember seeing him standing behind everybody. So again, I look at him and say my goodbyes. So they gave me some medication. I don't remember the name. And I feel like I have all of a sudden, like I feel like I have a rush, and my eyesight starts to slowly clear up, almost like the pixels on a TV. Everything starts to make a clear picture again. My blood pressure comes down. And then I can see everybody around me. They look calm, like they've been there watching me the whole time. And, their conclusion was, well, it looks like you did have a episode of pre-eclampsia. I think that my case at that point was just so convoluted. I had all the MRIs, the CAT scan, the headaches. They also started the magnesium as well. But after that pre-eclampsia episode, then was 2 nights in the ICU.
Wow. That was a lot.
Yeah. It was, very, very traumatic. And so, trying to figure out who's watching the baby, who's taking care of the baby, who's feeding the baby, in between all of this, like, I don't know what I would have done if I was by myself and I was completely just not able to take care of him.
What was your knowledge about preeclampsia before? Like, did you know anything about it?
I thought it was I knew that high blood pressure was a component. And I just thought it was people that before they were pregnant already had high blood pressure, or people with like poor diet or something like that. Like, I didn't think that I would be a candidate for it at all. My diet was pretty good. I never had any issues with high blood pressure. So I didn't understand the mechanics behind how pregnancy can cause high blood pressure episode that can be really scary like that. I didn't know.
What was like the post-hospital follow-up for the preeclampsia?
I saw my OB like a week later. And so when I saw her, she was like, oh, let me see the baby. how's everything? And we're looking at her like like a cartoon when the eyes are black and sunken because looking at her like a cartoon, but that was definitely the most scary experience. And I'm thinking like, if I wasn't buzzing, if they had waited an extra minute or two, would I have had a stroke and died? Like, I feel like it kind of got overshadowed a little bit. And to this day, as recently as maybe a couple months ago, I still ask my husband, like, when you came in and they gave me medicine, if you guys were like, the staff, if they were like 2 minutes later, what would have happened?
As you all can tell, Sasha had a very traumatic birth. I know listening to her story can be scary, but there is a lot that we can learn from her experience. So let's break it down. She mentions different types of headaches. So let's further discuss headache in pregnancy.
In medicine, when we're trying to determine a diagnosis, we call it a differential. That's basically a list of different diagnoses that we think may be the cause of the present symptoms. So in this case, the differential diagnosis for a headache in pregnancy and postpartum included, number 1, preeclampsia. This is having high blood pressures in pregnancy and sometimes is associated with a headache. Number 2, it could have been a spinal headache. This usually happens after an epidural is removed and a headache that improves only when the person lays down. So it's a really weird feeling. Or number 3, it could just be the run-of-the-mill migraine or headache that someone is experiencing.
Okay, but in Sasha's case, they thought she had preeclampsia. So let's get into this. Preeclampsia is elevated blood pressures that lead to in-organ damage that occurs after 20 weeks gestation. What's considered an elevated blood pressure? Well, that's a reading of 140/90 or greater on 2 separate occasions. In the case of preeclampsia, this is associated with one of the following. Number 1, protein in your urine. Number 2, low platelet levels, which are cells that help your blood clot. Number 3, kidney or liver injury, as seen on your lab results. Number 4, fluid in your lungs. Or number 5, non-resolving headache or vision changes like blurry vision or loss of vision. But severe preeclampsia is when your blood pressure is 160 or greater, over 110 or greater on 2 occasions, requiring blood pressure medication to correct it, or just having one of the features I just mentioned.
So what are some of the risk factors for actually developing preeclampsia? Number 1, being a minority is one of those things, or having low socioeconomic status. Also, if this is someone's first pregnancy, they're at higher risk of developing preeclampsia, as well as people who are obese, who are 35 years or older, or who have had a history of high blood pressure in a prior pregnancy, or they have a history of high blood pressure in general. These are just a few. We will include a survey to assess if you are at risk of developing preeclampsia. So, is there anything you can actually do to prevent preeclampsia? Some people think that diet might be associated with it, but that's not the true cause. To be honest, we don't necessarily understand why preeclampsia happens, but there is one thing that people might be able to do to prevent it. There is data from the Society of Maternal Fetal Medicine that shows starting a baby aspirin every day at around 12 to 16 weeks can help decrease your risk of developing it by 30%.
So how do you manage preeclampsia? This includes lowering the blood pressure and, in severe cases, preventing a seizure with IV magnesium.
Now let's talk about this thing, the infamous magnesium. I'll just say it. If you have to be on magnesium, or ask anyone who's ever been on magnesium, you will feel like shit, okay? It makes you feel flushed, drowsy, lethargic, hot, and nauseous. But it helps prevent severe complications of preeclampsia, which is called eclampsia or toxemia, as people might say. This is basically having a seizure in pregnancy. Now, I don't know about you, but I would take on those shitty symptoms to avoid seizing.
But how long do patients have to stay on magnesium if you feel terrible on it?
Usually it's at the time of diagnosis in the case of severe features, up until after 24 hours after delivery.
Okay. Now let's talk about treatment. It's delivery. For mild preeclampsia, it's delivery at 37 weeks or time of diagnosis if it's after 37 weeks. While in the case of severe features, preterm delivery at 34 weeks is indicated or earlier if your symptoms worsen. It's important to know that you can develop preeclampsia in the postpartum period too for up to 6 weeks afterwards. So please reach out to your provider if you have any of the symptoms we mentioned. Also, it's important to know that you should have your blood pressure checked 3 to 7 days after delivery to see if you need to start medication at home if you developed severe preeclampsia.
Yes, unfortunately, in postpartum, some women may have a spike in their blood pressure or experience symptoms like a bad headache or visual changes. So this is called postpartum preeclampsia. This oftentimes happens 4 to 7 days after delivery or by the time you had gotten home. So this can logistically be a challenge for your family because you just went home, you're home with your baby, and now all of a sudden you have to be hospitalized again, and now feeling like you have to be separated from your baby. Every hospital's policy is different, but oftentimes the baby can room in with you as long as another adult is present. Because remember, your baby is no longer a patient in the hospital, it's a special visitor. Some people might decide to not have their baby in the hospital room and coordinate breast milk drop-offs instead. At the end of the day, do what works best for you, your family, your hospital, and your clinical situation.
Clearly, Sasha had a few issues postpartum that made caring for herself and her baby difficult. So let's hear the rest of her story to see what else she has to share with us.
So is there anything that you're still struggling with or processing due to your experience?
Oh, yeah, for sure. I'm still struggling with what could we have done differently to make that experience any better. Sometimes like, should we not have gotten the blood patch? Because I didn't want to do it at first. Maybe I had a preeclampsia episode because I exerted myself. Why did I do that? My husband has a lot of regrets as well. I think he feels like he should have asked, I don't know, even more questions. How could he have been more helpful? He should have been more of an advocate for me, but he was going through his own experience, right? And we're trying to make sure I'm okay, about to be a dad. So I feel like he definitely feels like he should have been an advocate more. And I'm trying to figure out how I could have been an advocate more for myself. With these varying opinions, and you guys should do this, and you guys should try that. We're talking to the neurologist. Why is the headache so bad? Try 2 liters of fluids, see how that goes. So it was just like we were just out in the wild, just trying to figure out things. And I don't know what we could have done to prepare better. It was just like one thing after another.
Yeah, there sounds like there was a lot of moving parts. And
right.
Obviously things that you weren't expecting to happen happened. And so how do you prepare for something that you don't know is even going to happen, right? And so so I'm just so happy that you're sharing your experience, because the more exposure people have to listening to people's stories, the more the better informed you are for these experiences. But, I don't think that there's anything that you made a wrong decision about. Like, you were just going with the information that you had in the moment, right? You had just had a complicated epidural and then had a headache. So a blood patch is a reasonable thing to try to think about, and your blood pressure hadn't gone high yet. But now looking back, we see all the signs, right? So it's like hindsight is, it's 2020.
I think that we deferred a lot to the multiple teams that were there. And I feel like the OB team was wonderful. And it seems like they also expressed that they weren't the most pleased with the facilities. We did write the hospital, why was a CRNA in training the one to administer the epidural in the first place? Well, it's a learning hospital. So I think that it's just one of those situations that I have to thank God that at least I had my husband and mom with me, because if I was by myself, I'm just like, I don't know. I don't know what would have happened if I was by myself. And so I think, things worked out the way they worked out so that I could tell my story, so that I could see how much support that I do have, so that I can learn to be an advocate, in the future for myself, for my child. Sometimes you have to go through things like that to so that way you can be an advocate next time. Maybe you don't have as many resources. But I would definitely say to anybody listening that do not do it alone. I don't care if it's like find somebody, a friend, a neighbor, a coworker, obviously, mom, sister, somebody. It's not something that I would wish on anybody to do it by themselves, because anything can go wrong. It's not something that you want to do by yourself.
Thank you for saying that. And that's the point of this whole thing, building your birth squad, right? So is there any other advice that you want to give our birth warriors out there?
I think that being vulnerable and transparent with how you're feeling is with yourself and with anyone that you can trust, even if it's strangers online. I think it's better to do that, to realize that you're not alone. I feel like only maybe because I've gotten older, or there's just more access, social media. This whole thing about birth and pregnancy is flowers and rainbows, and you have a baby and then there's this like, oh, moment, and they bring the baby to you. Like, that is not reality at all. And, people putting pressure on you to feel that way, like this is just a glorious moment and you should feel thankful because some people can't even have kids, blah, blah, blah. Like, two things can be true at once. I hate this experience. I hate being pregnant. I hate giving birth, and I love my child. Like, two things can be true at once. So don't be afraid to embrace those feelings, because the sooner you're honest with yourself is the sooner that you can, digest those feelings and then move on. I would say don't pressure yourself to breastfeed. All 6 days in the hospital, I definitely was pumping, every 3-4 hours as much as I could. And for some reason, because somebody close to me who had a child who at that point had breastfed for like 2 years and was all about breastfeeding, I felt like, challenge, I'm going to do the same thing. And so I had breastfeeding was like, I'm going to do right by my child and I'm going to breastfeed come hell or high water. I had a lactation consultant visit me at my home. She did a very painful breast massage. I mean, I was like crying. And I think I lasted a good maybe 8 weeks total. And then I was like, you know what? Millions of children grow up on Similac and they come out just fine.
Right.
So from that point forward, we did formula. My son is 15 months. He's like 30 pounds and he's 99 percentile on everything. So I don't know what was in that Similac, but he's doing all right. So like the pressure, I even felt pressure to not get an epidural. Like, real women don't get epidurals. Bump all of that.
Bump all
Do
that.
what you gotta do to survive.
Do what you gotta do.
To
Seriously.
survive.
Yes.
Like, forget all of that. And even like I know this is like about, birthing and all of that, but then there's a whole other chapter of, the first year or the fourth trimester, and just there's all the things that come with motherhood and all the pressures, either from our parents, grandparents, what we see on TV, social media. Really embrace the mother that you were meant to be. Like, this child was given to you specifically for a reason, and just go with your gut and your feelings. And don't be afraid to try things your way, and you'll be okay.
Wise words, friend. Very wise words.
Yeah, definitely, and it took me a while. Like, even, he's 15 months now, but I would say for the first like 8-9 months, it was definitely a lot of other voices, like, you should do this and you should do that and you should do this. And then I finally realized, like, you know what? I'm his mom, and I think I'm going to make this decision. So and I think I had lost a lot of my confidence during pregnancy. So, the when people say, you lose yourself, you lose who you are, all that's true. That's another podcast we can do. But I lost a lot of confidence in who I was during the pregnancy. I think I just kind of lost my mind, and postpartum depression, not to mention. And so it took a while to get that confidence back.
How did you get your confidence back?
So a combination of, I would say my faith, medication, which took me a while to start because I was afraid of all the stigmas that come with starting antidepressants. That took a while to start, but I finally did. So medication, faith, support. My husband was very supportive in there is no stigma, do what you got to do, exercise. So definitely a lot of support. And then I think over time, it takes time making little decisions and being okay with it, and then making a bigger decision and making a bigger decision. You just got to put one foot in front of the other.
Absolutely.
And it gets better with time.
Thank you so much, Sasha, for sharing your story. Any last words or anything else you wanted to share?
Who's in your squad, yo? If you are pregnant, if you are thinking about getting pregnant, get your pen and pad out, get you at least 2 people. I mean, 2 people are a blessing, even 1. And it may not always be mom. Sometimes you need somebody a little bit more objective, right? And if you have a coworker, if you have a friend, it may not be your best friend, it may be another friend, but start planning who's in your squad. Start planning for postpartum. What is the first 90 days going to be like? Are you going to be home? Are you going to have support? Nanny, babysitter, daycare, whatever that is. I think because my pregnancy was just trying to get minute by minute and not throw up, I did not plan for postpartum, but plan your birth squad, plan your postpartum squad, and you will be okay.
Yes, thank you.
Thank you. This was really hard, by the way. We had this scheduled before. I don't remember why we ended up rescheduling it, but I remember thinking thank God, I really didn't want to do this. And I thought that it would be really hard to talk about, which it was, but I actually feel very liberated. And then, if we can help one person, then it was all worth it.
Yes. Well, thank you. We appreciate you coming out of, the depths of this experience, because it was hard and you really went through the ringer, and, you really show the grit of pregnancy and, the unglamorous part of delivery and the complications that happen, and how you can still thrive and grow and learn and gain new skills as a result of that. And then, be the wonderful mother that you are now.
Yeah, for sure. Thank you, guys. I'm glad I talked about it.
Thank you so much, Sasha. I loved having you here today and truly appreciate you taking the time to be part of the Birth Squad.
Oh, thank you so much. Love you guys.
Well, y'all, thank you for listening to the Birth Squad.
We're going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts.
Remember, as you navigate your healthcare journey, that you are beautiful, you are brilliant, and you are brave.
We at the Birth Squad would love to hear more from you. Tell us what topics you'd want to hear more about. Hit us up on Instagram at The Birth Squad and on Twitter @_The Birth Squad. Most important, make sure to share this episode with your squad. Until next time, I'm Dr. Ijama Okwandu.
And I'm Dr. Kamisha Thomas. Peace, love, and solidarity from the Birth Squad. Check out the podcast description for the explanations on some of the terms that were mentioned in the podcast.